Welcome to Rainier Avenue Radio .world. It's me, Tony B., your host of our special coronavirus broadcast that we've been doing. Well, we started our first one on March 13th. It was that week that things began to change, and we started to hear from community members about what was taking place with their businesses, what was taking place educationally, what was taking place with service providers, where was food available, and I think that you all remember this big deal about toilet paper. I found out a couple of things that folks need in this crisis. They need shelter, they need food, and apparently toilet paper. Right now on the program, joining me, and I want to make sure I get this right. I know it was the first time a lot of people heard about it. Is Carolyn Bick. Carolyn, are you there?
Yes, hi, I'm here. Can you hear me?
Yeah, I'll have them turn you up a little bit so I can hear you a little better. And Carolyn, let's start with this. I think for a lot of folks, the first time they heard about a testing center in South Seattle for the coronavirus was through an article that you wrote for the South Seattle Emerald. So, how did that happen? Did you break that story? Did you uncover it? Where did the information come from for you to put that story out there?
I cannot claim that I independently came to this knowledge on my own. Actually, major thanks to Linda Green of the Southeast Seattle Senior Center, who passed along the message to Marcus, the South Seattle Emerald's publisher, who then passed the info along to me, and then we just jumped on it.
And when you say you jumped on it, what were some of the first things that you did in order to say, okay, I'm going to write this story. This is something that people really need to know about. As a journalist, what were the actions that you took at that point?
I just reached out to Linda, who was courteous enough to
Okay.
play phone tag with me just for a little bit. After which I reached out to Paula Houston, who's the UW contact for the story, as you probably read in the story itself. She is the director of healthcare equity.
And from your knowledge, again, for if anyone has not seen the article, obviously you can go read the article. But we've got the journalist who wrote the article on the show with us, and I'm sure that you can catch it at the South Seattle Emerald. I'll give a shout out to Marcus Green. Um, Tell us again. You wrote about it, but just tell us about it for folks who may not heard about it or haven't had the time to thoroughly read what's going on. Let us know what's happening with this testing center, at least from what you know at Rainier Beach, where it's at, how it works, whatever you've got knowledge of this testing center.
Yeah, totally. So actually, we decided to do a follow-up just to kind of show people what would happen at the testing center. So we did, so actually, I think that article was published yesterday. No, no, it's on Wednesday. I apologize. I get my days mixed up these days. But it was published on Wednesday, which was the first day of the testing center being open. And so basically, when people go to test the testing site, which is at the Atlantic City Boat Ramp, which is basically right across Rainier Beach High School, they will be walking up or driving up, depending on their method of transportation, to a van, which is usually used for the healthcare for the homeless initiative, which goes around to test folks who are homeless or housing insecure. But for 2 days of the week, for at least the next 3 months, it's going to be testing folks who are vulnerable in the South Seattle community. And that's something that Paula Houston really wanted to drive home, is that this is mainly for frontline healthcare workers who live in South Seattle, or for other vulnerable communities who don't have easy access to testing. So people like seniors, or those or communities of color, who have underlying lying health conditions. And basically, what happens is, either in your car or on foot, and you will get the nasal swab that we all, have heard about at this point, up your nose for, from what I understand, a very long 10 seconds. I think it's both nostrils, but don't quote me on that. And as far as I understand, you will get your results the next day. And if you're positive, they will call you right away to let you know.
Okay. And one of the big questions, again, just as far as you know, who can be tested? What are the guidelines for being eligible for the test? Uh, do you what do you have to have in regards to identification to take this test? Do you need a doctor's note? What can you just walk up and say, "Hey, I think I have the systems. I think I have the systems or symptoms." How can you get the test?
So it doesn't matter if you have symptoms or not. But again, Paula Houston, the director of healthcare equity, who's heading this, really wanted to emphasize is that this is really for the vulnerable South Seattle population.
Hmm.
And so, of course, you are welcome to get tested regardless. But, they can only do 100 tests a day. Tests right now are scarce. So, you know, I understand if people are anxious, generally speaking, from elsewhere in Seattle, but if they have other places to go, they should go to places other than this walk-up clinic, if they don't live in South Seattle or aren't a member of a vulnerable population. Now, that being said, you don't have to be presenting with any symptoms at all. Um, you could just have been potentially exposed, say if you're a frontline healthcare worker, or if you have a member of your family who is sick, you can bring them, or you can get yourself tested just to see, kind of what's going on. If that family member is, too sick to go out, you can see if you might have contracted um, the virus, novel coronavirus, if they've had it too.
Again, you're listening to Rainier Avenue Radio .world. It's me, Tony B. My guest is C.E. Bick. Carolyn Bick wrote an article in the South Seattle Emerald about the testing center that is there now and will be open Wednesday and Saturday. Carolyn, do you know how many folks took advantage of the opportunity to get tested last Wednesday?
No, I don't. Or the other, the 22nd. I don't know how many folks took advantage, but I do know that, it takes time to build up trust in a community in general, especially within vulnerable communities. So, the testing site is there for the long haul. I did also want to mention, because you asked and I completely forgot to mention it, that they won't be asking, for identification or documentation status, anything like that. So, if you are documented, you're worried, you should definitely go get tested there. The only things they'll be collecting are race and ethnicity data, just so that we can build up a bigger data. They can build up a bigger data pool to understand who is most at risk for this disease right now. Because as we've seen across the U.S., in multiple states and communities, it's mainly people of color, specifically disproportionately Black Americans who are Black communities who are at risk for this disease.
And one of the things, Carolyn, that you brought it up before. There is a history, and it's a history that's in place for a reason. And if you want to find out all the reasons, then you can Google and find out why, in particular, the African American community is distrustful of vaccines and testing because of the number of criminal things that have been perpetrated against, I'm Black as well, against us when it comes to the medical community, being infected with things without being told, having our cells and genes used in some instances, in one particular instance, that has saved lives all over the world. But the person who gave this did not receive any compensation. So when doing this, do you have any information that you can let us know when I say who's behind this? Where does this information go? And what's it going to be used for? I know this is a bunch of questions. Is this in line with what Governor Inslee says when he says we need to be able to track information? Is this in line with the federal effort to be able to trace and track information? I know that's a bunch of questions, but I think you know what I'm essentially trying to get at here. People want to know what's the deal.
People's information, personal information, won't be shared or compromised, as far as I, understand. Me, because this is was pointed out to me multiple times at the site. This is just like a normal healthcare setting. Your data, your information is private. It's between you and the doctor. If you choose to share that information, that's up to you, but the doctor will not do it.
And how did I want to get back to just you being a journalist here. When all of the things happened, the stay-at-home or the stay-at-home order, and before that, even initially when it was, well, you can't gather in more than 250, and then it went down to 50, then it went to 10, then it just went to stay at home and isolate. How did this impact your ability to do what you do as a journalist?
So I'm both a writer and a photographer, and it definitely impacted my ability to go out and make photos of various or for various articles, simply because most of the articles for which I make photos involve lots of photos, because I'm used to going out to covering, because I do obviously write more, I guess, in-depth serious stories, and then I also cover stories that bring more joy, like festivals or parades or things like that. So in the sense of in the ways that I was impacted, it was more along the lines of my ability to go out and make as many photos as I'd like. But in terms of writing, actually, I've been doing a lot more since becoming the Emerald's COVID-19 reporter. Um, and I've actually found it easier, I suppose, to schedule some interviews, because, quite frankly, people don't have don't have the excuse of, oh well, I won't be home.
Mm. And in regards to doing, and I know you can't speak for all journalists, but in regards to doing stories like this, what are some of the challenges that you face when you want to get more information, when you don't have access to the information that you want, when you literally, can't go to some of the places that you want to go because of the stay-home order? Does it impact and affect the what we as readers would see from a journalist because of these challenges or barriers, or maybe you might say again, it doesn't necessarily bring any new challenges or barriers, and maybe it makes you said in potentially made access to folks easier. And I'm just thinking, okay, well, that's one side of it, but is there another side of it that as folks who rely on information that people like you who are out there provide us, otherwise we wouldn't know? How does it change how you have to do your job in ways that prevent different challenges and barriers in access to information?
So that's actually a really great question, because I really enjoy providing a lot of narrative color in my pieces. And so in the past, before this crisis hit, at least in our area, I would include that narrative color after I'd gone out and, seen somebody or talked to them in person or been at an event. And now in order to provide the narrative color and really set the scene for readers, bring them into the story instead of just a straight, cold, just the facts, man sort of thing. I ask for a lot of detail now over the phone. I ask people what they're thinking, what they're feeling, what they smell sometimes, all of that, so that I can use that in the story to bring readers into it.
You're listening to Rainier Avenue Radio World. It's me, Tony B. This is our special series of shows discussing the impact of the coronavirus pandemic on South Seattle and surrounding communities. We've done a number of different shows, talked to a bunch of different folks, educators, grocery store, restaurants, small business owners, regular people, people who have been identified as COVID-19 positive, different community leaders from a wide array of communities. And joining me right now on the show is Carolyn Bick, who wrote an article that a lot of people saw that awared us that there was going to be a testing center that was opening up. And what's the name of that boat? It's Rain. I'm calling it Rainier Beach, but what's the exact location again, Carolyn?
Yeah, it's the Atlantic City boat ramp. It's gosh, I can even give the address for people who are listening right now, but it is again the address and all the information is within the article I wrote. But the address is 8702 Seward Park South, Seattle, Washington 98118. And no appointment is necessary. I want to emphasize that.
One of the things that I noticed was that there was really no signage. I don't know if that's changed since then, but there wasn't a lot there that would let someone know that there was testing taking place for the coronavirus. Not that it's your responsibility, or you may not have an answer to that question. But again, your thoughts on something as significant as this, and I don't know what the outreach was on behalf of the University of Washington Research Center, but in getting the word out about this, just your thoughts on how effective the messaging has been on sharing this with the community from the resource itself.
Honestly, I can't say since I'm not involved in the
Mm-hmm.
outreach. All I know was what was shared with me, so I shared it with the community.
Mm-hmm. And are you aware, well, again, when you got this information, are you aware how the information was shared or who the information was given to? What was your what can you tell us about your ability to gather information that you could share with the community?
It was really easy. Paula was really easy to get in touch with. She's very personable. I really enjoyed talking with her just in general. And she seems to really, she clearly really wants that info out there because it matters not just to her, but to literally thousands of people across the area.
And as a journalist, photographer, again, uh, this has become the thing that everyone is aware of and talking about. Do you feel that it's limited your ability to? I don't know what you would normally do or how you would normally find stories or see stories. Or on the other hand, have you had to say to yourself, hey, this is it. These are the stories I need to find out about. These are the things that I need to uncover. These are the things that I need to share with the public. How has it, or has it changed how you look for stories and what you're looking for in a story during these times?
Yeah, so it I obviously my role right now at the Emerald, I focus on stories that are related to COVID-19, but that doesn't mean that they can't uncover some, longer ranging, deeper problems that existed even before this pandemic hit. This pandemic is just an excuse to write about, is just another excuse to write about them through a different lens. So, for instance, I wrote about the current conditions within um, the Washington State or the Washington Corrections Center, Shelton, um, in a different story, and what the inmates were going through there. And it does also touch on the issues within prison to begin with, such as access to medical care or lack thereof.
One of the things that folks have been talking about that has, again, it was there before, but now it is just more prevalent. What we're calling the disparities for black and brown folks, for poor folks, for marginalized communities. As a journalist, as a reporter, what is your take on that? What have you heard? Are you seeing anything as you are writing and uncovering the stories? Is there some feedback or information that you have as a journalist that you can share with us about the impact of the coronavirus, specifically relating to the impact from your perspective on Black and brown folks and communities of color and marginalized communities?
Yeah, absolutely. I think, and this is something I've just been thinking about for the last, golly, however long we've been in this, to be honest. Uh, some folks continue to refer to this virus as an equalizer, and that is untrue. This virus is not an equalizer. This virus uh, opens up, it shows us just how unequal society is, and just how vulnerable communities of color and refugees and immigrants actually are right now, in a way that um, people just they can't ignore it, simply because of the nature of what's going on right now.
And I want to give you an opportunity for final words here. But before I do that, can you just one more again share with us the information that you have about the testing center, when it's open, what time it's open, who can get tested, when you'll get the results, what the confidentiality ramifications of this are, everything again, for anyone who is hearing about this, finding out about this, or tuning in to say, how does this work? Just share all of that information with us again.
Yeah, sure, totally. So the testing center will be open on Wednesdays and Saturdays, 9 a.m. to 3 p.m. It's at the Atlantic City Boat Ramp, which is 8702 Seward Park Avenue South, Seattle, Washington, 98118. No appointment is necessary. You do not have to have a form of identification, or let's put it this way, you don't have to worry about your identity being compromised or anything like that, because just like at a normal doctor's office, your information is confidential between you and the doctor. You should expect a follow-up, I think, within the next day to 2 or 3 days, but again, don't quote me on that. And with regards to any data they'll be collecting, it'll simply be race and ethnicity, as far as I know. And they only do it for demographic data, age as well, obviously. But they'll be doing it for demographic data to show in the long term how this virus is impacting the most vulnerable communities.
And again, do you know if this is aligned with the state effort or with the federal effort, or is this just something that's being done by the University of Washington?
I don't know. All I know is that the information will be going to the University of Washington, but Apple's names and documentation status will not be compromised.
All right. And Carolyn, I want to give you an opportunity for final words here in case there's something that I've missed or that you just want to make sure that you get out there.
Yes, I wanted to say that for those who can stay home, stay home, truly, please, because, talk is cheap. You can thank frontline nurses and other healthcare workers all you want, but when you go out, crowd the streets, or you don't bother to social distance while you're walking outside or anything like that, you're really just ensuring that this crisis continues longer and that more people die, and that more vulnerable communities like those we've been talking about are harder hit, and more people in those communities don't have a chance to live a full and happy life.
All right. Well, Carolyn, thank you. And as you continue to write these stories, I'm sure we'll be back in touch with you so that we can also get them over the air and share this information with people. Carolyn, thank you for joining us.
Thank you for having me. Have a great day.
All right. We're Rainier Avenue Radio.world. We'll be back right after this.
You know you can't get enough of Rainier Avenue Radio.world.
Lave as manos e desinfecta as coisas ao seu redor. O coronavírus é real. Seja inteligente quando se trata de lavar as mãos. É incrível saber que esse vírus pode viver em superfícies por até 9 dias. E por isso que é muito importante desinfectar as coisas que uma pessoa infectada pode tocar, como o seu celular, por exemplo. Mesmo que você lave as mãos com frequência, mas use o celular, os germes retornam às suas mãos imediatamente. Quando foi a última vez que você limpou seu celular? Quando o vírus é transmitido pela tosse ou espirro, pequenas gotículas viajam pelo ar e pousam em superfícies que você pode tocar com as mãos. No geral, tocamos nossos rostos 16 vezes a cada hora, e é por isso que é muito importante lavar as mãos e limpar as superfícies que costumamos usar, incluindo o celular. Esta mensagem é um serviço público da Rainier Avenue Radio.org e Somali Youth and Family Club.
Hi, I'm Paul Pearson of StarTime. Did you know that back in the 1930s, Rainier Avenue Radio operated out of a supply closet in the Columbia City Sea First Bank? Well, times have changed and so have we. Now you can hear all the great Rainier Avenue Radio shows on our mobile app for Android and iPhone. It's completely free on the Google Play Store and the iPhone App Store. The Rainier Avenue Radio app.
This is your Rainier Avenue Radio.world community update on free Ancestry database access through King County Library. Through April 30th, you can now access the Ancestry database outside the library. Search billions of records to discover your family story, discover the meaning and history behind your last name, and build your family tree. Log in with your library card at ls.org.
This is Paul Pearson, host of StarTime. And when I'm not meeting Mrs. Jones in that cafe for a chat and nothing else, I'm listening to Rainier Avenue Radio.world.
Wash your hands, don't touch your face, wipe things down, clean up your space. When you cough and sneeze, do responsibly. If you feel you're getting ill, isolate at home and chill. No, you're not alone. Please pick up your phone and call 206-477-3977. King County 206-477-3977. Public Health 206-477-3977. King County 206-477-3977. Public Health Community Radio Station will provide you with more information. Say Rainier Avenue Radio. Your community radio station will provide you with more information. Rainier Avenue Radio.
The